Alright, hi dear doctors, welcome to Kids Covery. Myself Dr. Parv and I'm your pediatric faculty. So the topic of discussion for today is going to be DiGeorge Syndrome. Anybody, your batchmates, your seniors, your juniors, you ask anyone what is DiGeorge, they'll say catch 22. Okay. So catch 22 is the most famous, even famous than Nora Fateh herself. Catch 22 is the mnemonic to remember what are the features of DiGeorge syndrome. So what is C? C is cardiac defects, and the most common cardiac defect which is seen in DiGeorge syndrome is tetralogy of Fallot. Tetralogy of Fallot, most common in the DiGeorge syndrome. So can you understand DiGeorge syndrome, tetralogy of Fallot? Okay, so this is how you are supposed to remember. Okay, how? Because F and G come very close in alphabets. DiGeorge syndrome, tetralogy of Fallot. A for abnormal facial features. The facial features are abnormal. T for thymic aplasia. Thymus is not formed properly, thymic aplasia. C for cleft palate. H for because there is parathyroid and is not formed properly, that's why there is hypoparathyroidism and hypocalcemia, and 22 means 22q11 gene deletion. So C for cardiac abnormalities, A for abnormal facial features, T for thymic aplasia, C for cleft palate, H for hypoparathyroidism and hypocalcemia, and 22 is the 22q11 gene mutation. Can you see this? I'm really sorry for the blurred picture, but then can you see this? The head of the baby. This is not the puff. I mean, of course, there's a hairstyle now, puff hairstyle, but this is not a puff. In fact, the head itself is very small. So there is a small head which is going to be there. Okay. So this I'm showing you just to tell you what are the facial features. So head is small. Okay. After head, what is next? This is the nose. So there is a low nasal bridge. There is a low nasal bridge. Then epicanthal folds. So near this, okay, so this is the canthus. So there is a epicanthal folds which are going to be there. Then upper lip is thin and the jaw is underdeveloped. These are the 4-5 things you have to remember. See, the head is small. This is flat. This epicanthal fold. Upper lip is small. The jaw is also underdeveloped. These are the facial features. So DiGeorge syndrome, because of the gene 22q11, what is the issue? That the fourth pharyngeal pouch is not formed properly. Fourth pharyngeal pouch, and in fact the third pharyngeal pouch also. Now the third and fourth pharyngeal pouches are responsible for the formation of thymus and parathyroid gland. Okay, so thymus, TH word is coming related to third pharyngeal arch, and the third and the fourth pharyngeal arch, both of them are responsible for parathyroid. So there is no thymus, there is no parathyroid, and because there is no thymus, thymic hypoplasia, there is a T cell deficiency which is going to occur. And because there is T cell deficiency, there is going to be fungal infection, there is going to be viral infections, both of them are going to occur, and this is responsible for causing pneumocystis jirovecii pneumonia as well as candida infections. So can you understand, your T cells are not functioning properly? That's why there is pneumocystis jirovecii infection and there is your candida which is going to be there. This mnemonic I have already used with you, PCT. In our med school it used to happen, part completion test PCT. So P for pneumocystis, C for candida, and T for T cell deficiency, or this you can remember by this, take care Parv. So TCP or PCT, that's important. So, and with your physiology, that if the parathyroid is less, the calcium is going to be decreased. And in order to see this, catch 22, but the full mnemonic is catch 22 fish. That means fluorescent in situ hybridization is the technique which is employed to see the microdeletion on the chromosome 22q11.2. So if you want to see the deletion in 22q11.2, you have to do what? Fluorescent in situ hybridization. Once you perform the X-ray, you will see that there is no thymic shadow because the thymus is absent, And DiGeorge abnormality can also occur in the alcoholic mothers. So what is going to be the feature? I've told you there is facial dysmorphism, there is cleft palate, okay, there is cardiovascular abnormalities, all these things. Now see, understand, they term one important thing. This is called as Velocardiofacial Syndrome. Cardio means heart, facial means face, and velo refers to palate. So the palate is also gone, refers to the cleft palate or the abnormality of the soft palate. Out of all these things, what are the major causes of death? Of course, the congenital heart disease is the major cause of death, which you have to understand. And the infections which are going to occur secondary to the immune deficiency, this is the second most common cause of death because immunity is also low. So this is all about the DiGeorge syndrome, and this DiGeorge syndrome is an important question when it comes to the pediatric genetics. Thank you so much for joining. We'll see you in the next class.